Good afternoon, ladies and gentlemen. My name is Darcy Murdoch. It's great to be back here for this afternoon's program. And you can see that the speaker is very anxious. She beat me up here to the stage, but I'd like to introduce this lovely lady who goes by the name Dr. Jenna. Are you a doctor, Jenna?
Respiratory therapist.
Okay, well, we'll give you that anyway. This is Miss Jenna Jangalee. Jenna is a registered respiratory therapist, certified respiratory and tobacco educator. Jenna did her undergraduate training at McMaster University in Hamilton and her respiratory training in Toronto at the Michener Institute for Applied Health Sciences. Upon graduation, she set her sights west and has worked for Vancouver General Hospital for 15 years. Jenna enjoyed working with patients through the acute care specialty programs at VGH, but found her calling with clients who live with chronic lung disease. Jenna has honed her educator skills through her work at a large respiratory clinic, and more recently by running the pulmonary rehabilitation program at VGH. With Jenna's commitment to a personalized and preventative approach to care, she has co-founded Poplar Pulmonary Wellness. Poplar is an online respiratory therapy company that focuses on providing education, exercise, and community to those who live with chronic lung disease. Poplar's vision is to empower people to live their best lung life. And there's actually a table set up with all kinds of information in regard to Poplar Wellness. So I would like to introduce Jenna Jangalee. Thank you, Jenna.
Hi, everyone. Thanks for having me here. We're going to talk about COPD. Can I exercise? Yes, absolutely, 100%. Why wait to the end of the presentation to hear that answer? So absolutely, exercise is crucial for those living with COPD. Very small caveat of patients who have unstable cardiac disease should really talk to their physicians about how or whether they should start an exercise program. But for the majority of those with COPD, the answer is a resounding yes. So I just wanted to highlight just a conflict of interest and mitigating bias. So as Darcy said, I am co-founder of Poplar Pulmonary Wellness. We do provide online pulmonary rehabilitation, and I will be talking about that in this presentation. So to mitigate that bias, I'll be offering up evidence-based data on exercise and pulmonary rehab, and offering multiple services of how to access pulmonary rehab in BC. So the objectives that we'll go through today, so identifying the positive health impacts of exercise on the body. We're going to describe how exercise can improve COPD symptoms, and we're also going to explain how to access pulmonary rehab programs in British Columbia, and discuss some practical tips for starting an exercise plan. So what does research tell us about exercise? And very simply, we can boil it down to moving is better than not moving. And that could be hard. So we have our little comic strip here of our duck who's warming up, so to prevent injuries before a workout. And but also, if you stay really warm, you can prevent working out too. And so as we head into these colder months, it can be hard to get out there and do your exercise routine. But just remember, moving is always going to be better for your health outcomes than not moving. So what happens if we don't exercise? And this has been really well researched. So it can increase the prevalence of a lot of chronic diseases in our body, including cardiovascular disease, high blood pressure, high cholesterol, diabetes, insulin resistance, certain cancers like breast cancer, colon cancers, anxiety, and depression. And we heard earlier about how those living with COPD can be prone to experiencing anxiety and depression. Obesity, falls and fall-related injuries, poor cognition and memory, poor quality of life, and mortality. However, what can we do about this? We know that COPD for many of you is not in a silo. You may be living with some other chronic conditions. And so I encourage you, I really like this YouTube video actually. It's from Dr. Mike Evans. So he's a physician and professor out of the University of Toronto. And he's got a really great video called 23 and a half hours. So if you Google that or go on YouTube, you can look it up. It's about a 10-minute video, and he really, in a fun, easy to digest way, kind of lays out a lot of the studies that show that the single best thing we could do for our overall health is to exercise. He points out that it only will take half an hour of your day, so of your 24-hour day, it will take 30 minutes. It's a pharmacological approach. It's low cost, and it will help not only with your COPD, but other conditions of the body. So I've been hearing a lot lately as well, this idea that exercise, we should think of it as a biological need, much like how we need to breathe, or we need to eat, need to sleep. And so, if we think about it in that way, what are some really practical steps that we can do to get exercise in as this biological need? And so the Canadian 24-hour movement guidelines has a really succinct approach, and it reminds us to really make our whole day matter. So back to that idea of a 24-hour day, make all of it matter in terms of movement. And so the 3 recommendations are to move more. So for any adult, whether you have COPD or not, the goal is to try and work yourself up to about 150 minutes per week of moderate and vigorous activity. They also recommend muscle strengthening, so 2 times a week. But for those who are either new to their exercise plan or just trying to get back at it, perhaps after a flare-up, don't let this be daunting, because the guidelines also highlight that light activity or activities that focus on balance is as important as well. So even just doing activities that you normally would have done in sitting, but try and doing them in standing, can really provide a lot of positive health benefits. The other thing they encourage us to do is to look at reducing our sedentary time, so less than 3 hours of recreational screen time day, and to break up long periods of sitting. So for those of you who are working or do a lot of work in seated or at a computer, just that reminder to get up, take your break, stretch your legs, walk around, and really break up that sitting time. The third recommendation, which, I don't know that it gets talked a lot, but you could do a whole presentation on it, is sleep, and trying to get 7 to 8 hours of good quality sleep. And I know from talking to patients with COPD, that's easier said than done. Sleep is complicated. So if you feel like you're not getting your 7 to 8 hours of good quality sleep, do talk to your healthcare providers about it. Very simply, I could offer up a couple tips. So making sure that you have a wake-up time and a bedtime, trying to keep the bedroom a cool, comfortable, calm place, trying to avoid that screen time and caffeine quite a few hours before bedtime. So if we switch gears from sort of overall health and well-being exercise and look at it more in terms of COPD, we know that a lot of starting an exercise plan, again, can be a bit easier said than done due to the shortness of breath and fatigue experienced by those living with this disease. And there are a couple of different pathways that are involved in causing these sensations. So if we recall from what we've learned earlier on in the day, COPD, for many of you, is an obstruction of the airways, so inflammation, tight muscles, mucus, causing those airways to be narrower. So as you breathe in air, you may not be able to exhale all of that air back back out. Air gets trapped in the lungs, and we call this hyperinflation. So you can imagine then if you're doing an activity or if you're working out and your breathing rate is up, that you can be trapping quite a lot of air in the lungs to the point where it can be very uncomfortable. The other kind of pathways that can happen is depending on if you've got damage to the alveoli in the lungs, you might have impaired gas exchange, meaning that you're not getting oxygen into your bloodstream and that carbon dioxide out. And therefore, you might not be getting, the oxygen into your muscles. They might be using the oxygen very inefficiently. The less we do, unfortunately, the weaker our muscles get. So we need to keep them engaged and active. And so we've heard earlier on today about this idea of deconditioning and those weak muscles, and that really can lead you to doing a lot less. And then there's also a psychological component, and often in pulmonary rehab programs, they talk a lot about this and try and do some retraining, where, a past event that might have caused you to feel really short of breath, you have that memory, those neural pathways. So I'm not sure if this has happened with any of you where maybe you've had an event walking up a flight of stairs and you sort of get short of breath even looking at the flight of stairs before even walking up. And so all these things can often lead to a negative lifestyle cycle, which can result in anxiety and depression, reducing social activities and low self-esteem. The positive thing about exercise, though, is we can really flip that cycle. And I would have to say exercise and also with pulmonary rehab, which I'll talk about in just a little bit. So, the way that exercise fits into these positive lifestyle cycles is that although you may be diagnosed with lung disease, although you may experience shortness of breath and fatigue, through training with exercise, both keeping the muscles strong, learning controlled breathing techniques with physical activity, and retraining some of those neural pathways, you can reduce your sensation of breathlessness. And this, of course, will lead to less anxiety, more confidence, more control in your coping skills, and then that encourages you to keep up your social activities and your physical activities and increase your self-esteem. So if exercise is so good for us, if we should think of it as medicine, what is the exercise prescription when you have COPD? And so your exercise prescription can boil down into 3 parts, and I'll go into a little bit more about these parts in the upcoming slides. But the first one is an endurance or an aerobic activity, something that's going to bump up your heart rate and your breathing rate. The second part of your prescription should have a strengthening exercise. So something that's going to keep your muscles, work at your muscles to keep them nice and strong. And the third part of this prescription should be a flexibility, balance exercise, stretches. These are the things that can prevent injury and also prevent your risk for falls. And so this comic here has this physician who says, I'm prescribing you exercise. Think of it as a stress pill that takes 30 minutes to swallow. So for the aerobic and endurance part of the exercise prescription, if we think back to those activity guidelines, we are going to try for that 150 minutes a week. And this is moderate. Moderate would be something like a brisk walk, to vigorous, which could be something like hiking. You could break this down, however, so don't let this number feel daunting. You could break it down into smaller components, perhaps something like 30 minutes, 5 days a week. And if that is still daunting, you could break it down even further. So maybe you do 10-minute increments 3 times a day. And if you are building, don't worry about it. Just start with a few minutes and build gradually. So if it's 5 minutes today, try for 6 minutes tomorrow and build over time. Take your breaks as you need to and use controlled breathing techniques like pursed lip breathing. So aerobic activity is any continuous activity, and I have some examples listed here, but really find the things that you love. Do the things that you like to do. I always give the example when I teach pulmonary rehab, you're probably not going to see me out running. I don't particularly enjoy running. I like walking, I like skating, and those are the things that bring me happiness, so those are the things that I focus on in my exercise plan. So strength training, the second part of our prescription, so that these are the things that strengthen muscles. So we're thinking hand weights, we're thinking dumbbells, tension bands. You can use your own body weight. So for example, a squat is an example of a strength training exercise. Start light and easy and aim for about 8 to 12 repetitions. The strengtheners that you do should target the major muscle groups of your body, so they should have some upper body, some lower body, and some core. Once the light and easy weights feel comfortable, then you progress. So your exercise plan is dynamic. It's always moving or progressing. So you could try for moderate effort and then hard effort. And you try for about 2 to 3 days a week with a rest day in between. And lastly, that third part of the exercise prescription, the flexibility and balance. So we're aiming for a couple days a week. We want to stretch the muscles to prevent injury. So you want to stretch to the point of tightness, but you don't want to feel any pain. So if you're feeling pain, back off from that stretch. For adults, we want to hold the stretch for about 30 to 60 seconds. And for balance, practice balance daily. Very simply, think of those activities that you could do in standing. Use supports like tables or chairs. And again, do what you love. So even yoga, tai chi, those are all great examples of balance and flexibility. So if exercise is so great, shouldn't I just be able to continue with my exercise routine? Why does it feel so hard? And this can be a talk in and of itself, and I don't know that there's a magic answer out there. I did go back and look at some of the research to kind of bring a silver bullet, but it's really complicated. One way we could kind of break it down, or as an individual, you could kind of break it down, is looking at barriers. And some barriers feel outside of our control. We call those extrinsic barriers, things like weather or cost of going to a gym. Some things are intrinsic. They're within ourselves, within our control. And so I suggest to you to think about what those barriers are for yourself, maybe even write them down. Pick 1 or 2 of them to kind of work through. Because once we overcome those barriers, you can really reap the health benefits of your exercise routine. One way to overcome these barriers is to create a goal. And in pulmonary rehab programs, they do a really good job of determining sort of what's your goal at the beginning of the program and then reassessing it at the end of the program. I posed some questions here. So just thinking about, is there something that you can't do now that you'd like to be able to do? And so very simply, even just by answering that question, you can kind of work towards something with your exercise routine. So who can help you? So this idea of goal setting and putting together an exercise prescription, to some degree it can be really individualized. So who can help you? And I have listed pulmonary rehab on the top here because those are great programs to start out with. As well, maintenance exercise programs. For example, the BC Lung Foundation has their Breathe Right program. Physiotherapists and kinesiologists in your community, you can work with them one-on-one on your exercise plan. You can go to your local community center, YMCAs. When you look at some of the research, definitely the social aspect to exercise. So walking with a friend, walking buddy, walking group, mall walking group, those are out there. They can definitely help you to stick with your plan. And then there are online pulmonary rehab programs like Popular Pulmonary Wellness, Wilkin, or iMaster Health. And those are a great remote way to work on your exercise plan. So pulmonary rehab programs, what are they? They are, I've taken the definition of it and kind of broken it down into its parts, but it's a comprehensive, tailored therapy for those living with chronic lung disease. These are often structured education and exercise programs. They run for about 8 to 12 weeks. They often include a maintenance program after the initial program. They work on the exercise training, the education, and the behavior change, so working on achieving your goals. They have been shown to improve physical and psychological well-being, and they promote long-term adherence to healthy living behaviors. So what does research tell us exactly about these programs? So research tells us that these programs can both increase your functional exercise capacity and increase your quality of life. So increasing exercise capacity means it improves your ability to be able to do your regular activities of daily living. We often will do walk tests as part of the program, and we notice that for many participants, they can improve their walking distance as an example. You feel less short of breath, less fatigue. It helps to improve the strength of the muscles so they can use oxygen more efficiently. It improves balance, reduces risks of falls, and reduces hospitalizations. So we heard earlier today that if you have a flare-up, a worsening of your COPD, and you go into hospital, we learned how much lung function you potentially could lose. So we really want to prevent flare-ups, and we really want to reduce hospitalizations. For quality of life, you can improve mood, including anxiety, depression, quality of sleep, improve independence, and social isolation. So I've been given my yellow flag, so I'm going to motor through here. What can you expect? So you can expect to attend these classes in pulmonary rehab a couple times a week. They're often supervised, and your progression gets assessed on a weekly basis. And so your exercise prescription is constantly being reassessed. You get some monitoring. You can monitor heart rate, oxygen, blood pressure, shortness of breath. And then, of course, you get the education often from a multidisciplinary team on relevant topics like nutrition, breathing techniques, and disease-specific information. Okay, so to access them, do seek it out if you have not been to one or do not know of one in your community. So ask your healthcare providers. Some programs you will need a physician referral, and some you won't. These programs happen in person and online. The BC Lung Foundation website lists certain programs in the province. Seek out the programs early, so early on in your diagnosis. Please don't wait to end stage, because you want to learn those tools for your everyday living. Okay, so I had posed a question on the Facebook page for the BC Lung Foundation. What do people want to know about exercise? And the overall theme that I heard back was the question of how far can I push myself with exercise? So how much shortness of breath is too much? And so this is individualized. For everyone, it's a little bit different. At Poplar, we've come up with a term called an intensity check. So there are different ways you can kind of assess and see. One of the main ways is shortness of breath scale, so a Borg scale on a scale of 0 to 10, 0 being not short of breath, 10 being the worst shortness of breath you've ever felt. You kind of want to exercise in that 3 to 5 range. So when you're exercising, you should be able to talk to someone, but maybe you can't sing to someone. So that's kind of a way that you know you could push a little further or whether you need to pull back. The other way, those of you that have oximeters, you can do an oximeter check. An oximeter is a handheld device that checks heart rate and oxygen level in the blood. For COPD, we generally want to keep those levels 88 to 90% or above. And then there's this idea of good pain and bad pain. So that saying, no pain, no gain, we don't believe in that. So you might feel sore a day or two after exercise, but you don't want to feel pain. So if you're in pain up to 48 hours after exercise, you probably push too hard. So just some quick practical tips. So start light, start easy, and build up over time. Use warm-ups and cool downs. Don't hold your breath. So use those controlled breathing techniques like pursed-lip breathing. Use your inhalers and oxygen as prescribed. And don't feel hesitant about using walking sticks or walkers if they've been prescribed to you, because they can really help with your balance. When exercising outdoors, we heard earlier about checking air quality and pollen levels. And in terms of creating a goal, use the devices that are available to you, so activity trackers on your phone or your Fitbit, and of course, choose activities that you love and have fun. So I was going to try and do a stretch session, but feel free to stand up now in the spirit of the talk if you'd like to stretch your legs, and I'll just close up. So remember that exercise is medicine. It can reduce the prevalence of developing many chronic diseases. When you have COPD, exercise plays a vital role in increasing exercise capacity, reducing shortness of breath and fatigue. Pulmonary rehab programs, absolutely recommended. If you have COPD, seek them out early on in your disease trajectory. And although we know maintaining an exercise plan can be difficult, try and create a goal, include activities you love, and make your whole day matter. Thanks so much.
Thank you very much, Jenna. And I love that very first point you put up. Moving is better than not moving. I think if we all take that away, we'll be better off. Yeah. We've got, I think what we'll do is take maybe one question, and then we're going to have Ermina come up, and then we'll have some time for Q&A after, and maybe
Perfect.
Both of you can come back and answer more questions. But
Perfect.
is there any, does anyone have a question right away for Jenna?
Yep.
Yes.
What's the difference between heart rate and breathing rate?
Great question. So your heart rate, which can either be detected by checking your pulse, so that beat that you feel in your wrist or the side of the neck, or you can use an oximeter, so that device on your fingernail. So that is the beat of your heart per minute. So our heart beats, it pumps blood throughout our body, delivering the oxygen, and so it's the rate per minute. So often for an adult, it's between 60 to 100 beats per minute. The breathing rate is your rate of breath per minute. So just that inhale and that exhale. And so, again, that varies for everyone. For an adult, could be anywhere between 8 to 12 breaths per minute. Yeah. Okay. Thank you very much.